Thank you, Mr. Constantine. That great update. I know you guys definitely have your hands full, but appreciate all the work you guys are doing.
Thank you.
Are there any board members that would like to comment right now? I see Supervisor Maggard. Supervisor Maggard.
Thank you, Mr. Chairman. I appreciate that, and congratulations on your chairmanship.
Thank you, sir.
You're doing great so far.
I appreciate it. Working on it.
Yeah. Be careful. One of our colleagues, they made a video of him and all the times he ever misspoke, and he had to listen to it over and over and over again. Not to make you nervous,
Right.
but you'll be fine. Mr. Constantine, good morning, and thank you for your report to us. I am heartened by our ability to deal with the spike that we're experiencing, and I don't have a lot more to say to expand upon it because I think you did a thorough job. But I just want to assure the public that we are, even as we speak, we are exploring even more alternatives on how to find more staff to be able to staff these beds. The issue is not a bed or a ventilator or oxygen or PPE. The issue is nursing staff, and we are exploring even more options to be able to continue to supply those staff. So I just want to reiterate that point. And I also want to commend you and CAO Alsop, Supervisor Scrivener, and all the others that are involved in making sure that we are being very, very careful with the resources that we have to make sure that we can pay for these extraordinarily expensive but vital resources that we need to make sure people are taken care of. So I just want to reassure the public that we are endeavoring to do that as effectively as we can, and I'm grateful that we are in the position we're in, and to you staff for helping us get there. I know that Supervisor Scrivener has some other things to say about capacity and whatnot, so thank you.
Thank you, Supervisor Maggard. I don't have a whole lot to say, but I did want to drill down just a little bit more on the hospital capacity issue. And so the threshold for the current lockdown is 15%. We're at 8%, but the state, once again, with an arbitrary penalty, says that we're at 0, but the County of Kern sits at 8%. Obviously, not ideal, but at this current point, manageable. And this is something that we talked about, I think, the last time we met, as far as the hospital's ability to surge, to staff up, et cetera. So can you speak a little bit more to that, their ability to manage when these volumes go up, and where they're feeling as far as their positioning currently?
Yes, sir. So it's important to recognize that our hospitals are busy. They are impacted. The only other time that we have to compare this to is what happened in July. And this, as the hospital CEOs will tell you, is it's more of an impact now than it was in July. So it is stressful. They are managing. They're managing well. They have put in resource requests to us for everything from staffing to masks, and they're trying their best to manage. They, as an employer, also have employees that are exposed and have to be at home and quarantine and have to wait that period. So they are very busy. However, collectively, we have beds available. You're going to see some of the hospitals put up their surge tents. You saw that they did that early on. They weren't needed, but they're now reevaluating the need for that because at times they're impacted. They'll also tell you that this time of the year, when we typically see increased rates of the flu and other respiratory diseases, they are very busy. And at times they're struggling to keep up. So this isn't too unusual. Our concern is how high will this peak go and how long will it go for? The state's database is struggling. I don't even have numbers to report you today. It was down yesterday, it's down today. So those aren't accurate numbers that I could present to you today, but they are high. We're in the thousands every day. But each hospital is required to have a surge plan, which would allow them to increase capacity by 40%. They're not into their surge plan yet. So they have some capacity. As Supervisor Maggard said, staffing is the issue. We're fighting against other counties and other states. We have repetitively increased the amount of money that we're willing to pay for some of those ICU nurses, and they also struggle. As we've talked many times, we also have the alternative care site, and it is, we've been looking at Fresno County. They hired a company to help staff the Fresno County ACS. They're operational. We're not in that position yet. We don't need it, but we've also made contact to ask if they would have resources available, and they've indicated they do. So we have some capacity, Supervisor Scrivener. We're going to watch it carefully. It depends where this goes, but as it stands today, we're managing.
And you're in communication with these hospital CEOs and CMOs constantly, correct?
Yes, sir, daily.
Good. So thank you so much for that. How are we comparing to other Valley counties? Do you have any idea? Because I know that we're in a region now with other Valley counties, but I'm curious. Are we seeing some big stressors on some of the other counties, and how might that impact us here?
Yes, sir. So in the Central Valley, we operate generally in the same pattern. Many other counties in that region that the state has put us into are not as well off as we are. And I would suggest that because of some of our planning in advance and forethought and response from the public, we find ourselves in a better position than they do. But we recognize we're not an island. We don't, we're not independent. And if you live in Delano, you might seek service in Tulare or Kings or Fresno County. We recognize, and same with the southern part of Kern, you might go to Los Angeles for assistance. So the state has grouped us into regions, and we're managed into regions. In our case, that's probably not to our benefit. It's to our detriment. So far, it hasn't been significant. The state, though, is this weekend, and it was supposed to be issued yesterday, is talking about a statewide order, health officer's order, that would cancel elective surgeries, and that would establish a interfacility transfer committee that we would chair locally here to help move patients between hospitals. Both of those actions are being taken because of what's happening in other regions, especially in Los Angeles, where hospitals don't communicate together, and there's not a willingness to share and to move resources. And there's not a willingness to take some strong steps on the cancellation of elective surgeries. Here locally, our hospitals are doing that today. They, on a day-to-day basis, evaluate what they have, and they cancel surgeries when they need to. So they're ahead of the order. Now, they like the flexibility to say, today I'm good, we should allow some higher priority elective surgeries to go. When we talk about elective surgeries, these are still surgeries that are very important. This isn't some inconsequential surgery that's needed. People are in pain, they're struggling, and they're needed. And it keeps the hospitals economically viable, it keeps them fully staffed, which is what we need. And finally, our hospitals now transfer patients around now. They do this amongst themselves. They're good at it. They don't need us to intervene. So it is some action that will probably be taken by the state. They told us it would be released yesterday. We know it'll gain attention. I don't think it'll have much impact with us locally. We'll have to comply